So I'm Andrew Street. I'm Professor of Health Economics at the Centre for Health Economics at the University of York in the United Kingdom. I believe that hospitals should be paid on a fair and transparent basis. That means essentially equal pay for equal work. If we're to have equal work, we need a standard way of defining the activity that hospitals undertake. That means not only paying hospitals on the basis of the number of patients treated, but according to the type of patients treated. So we need a way of defining the case mix of different hospitals. That means a payment will be different if you're treating more patients for hip replacement than if you're treating patients who require coronary artery bypass grafting or patients who need their an appendectomy. In terms of equal price, it means if patients are being treated in one hospital for a hip replacement, the price paid in that hospital is the same as the price paid for a hip replacement in another hospital. So all hospitals doing hip replacement face the same price for treating patients of a similar type. So that's the essence of trying to ensure a system of equal pay for equal work. Of course, there is a problem that all hospitals say they are different in some respects. And the problem in setting prices and defining equal work is working out the legitimacy of those differences. So some hospitals say they have different costs because they're public hospitals or because they're private hospitals, some because they serve rural communities, others because they serve urban populations, others because they're doing teaching and research, others because they're providing specialised care, and others will say that they have different costs because of the location and the demands of the population that they serve. And the problem for price setting and for fair reimbursement is working out the legitimacy of those claims. And if there are differences, how can we take those into account in the funding regime? So the job of a funder is to work out what things are legitimate causes of cost differences among providers of different types. And those cost differences will be costs that providers can't avoid. It means that their costs are higher than other providers of a similar type who are doing similar types of activity, but they have higher costs because of some unavoidable differences. And the task is to work out what those are. Those types of costs fall into two main groups. There are regulatory costs and there are production process costs. So the regulatory system may incur different costs on different types of providers for different reasons. Providers may be subject to different taxation regimes, different performance management regimes, different reporting regimes. And to ensure that there is fair reimbursement, there needs to be standardisation across the hospital sector in terms of those types of regimes. The production process costs refer to the costs of hiring labour and costs of access to capital markets and the costs of the price of capital when hospitals are undertaking new buildings. And again, if there are differences in those types of costs, they ought to be adjusted for in the pricing regime. Hospitals face different costs because some of them do different types of activities. So some hospitals, as well as providing patient care, will also be providing teaching and research services. And those types of activities should be funded separately and transparently from the provision of direct patient care. So ultimately, there are a whole set of costs differences that hospitals faces, and for pricing purposes, the job is to work out whether those costs are indeed legitimate and what impact they have on the costing base. So to have a fair payment system, we need to ensure that there is equal work. We are defining work in a standardised way. We're able to set prices in a standardised manner we're able to take account of differential costs in a standardised manner, and the types of reporting and monitoring frameworks that hospitals face are standardised across the system. And if we can put those things in place, then that will help us work towards a fair funding regime and a transparent funding regime for the hospital sector in South Africa.